So what are box warnings by the FDA for breast implants? Hi, I'm Dr. Lisa Hunsicker. I'm a board certified plastic surgeon here at Ravala Plastic Surgery in Colorado. So many times we see patients who are considering breast implants, either in the form of a breast augmentation, perhaps an augmentation with a lift, or perhaps even for reconstruction. And the question that they ask is, what are box warnings and what does the FDA say about it? Well, the FDA box warnings have basically three issues that they're trying to cover that they want to make sure each person who is having breast implants knows about. So the first one, the number one, is rupture. So the one thing that the FDA wants you to know about is that all implants are going to rupture. We don't always know when that's going to happen, and so you want to make sure that you follow the guidelines, especially if they're silicone, to do the FDA screening protocol, which is starting 5 years after surgery and every 2 to 3 years doing either high-res ultrasound or MRI. Now, if you have a saline implant, you're going to know right away because it's going to deflate, and so you'll have an unevenness, and you might wake up and one's still inflated and the other is deflated, and because it's saline, it's going to be absorbed. So that's the quick and easy way to know about that. Now, the second is what's called breast implant illness. And so there are some people who believe that breast implants cause autoimmune. Now, we don't really have good data to support this, but there are some people who are struggling with implants that have autoimmune symptoms, and we don't really know where it's coming from. The one thing that I always want my patients to know is you can have breast implants anytime you want, and you can also remove them at any time if you want. So if you have implants and you're starting to have symptoms that you're not comfortable with, you are able to remove that. So let us know if that's an issue for you. Now, the last one that the FDA wants you to know about are there are 3 cancers so far that have been associated with breast implants. Now, we don't know the cause of these. The first is called anaplastic large cell lymphoma, and these have been associated with textured implants. So it doesn't matter if it's saline or silicone, it's just the rough outer shell. We really don't know the exact cause. We do think that there's probably a link to bacteria and also the JAK and STAT genes, which we feel maybe are modulating the immune response to that bacteria, and people aren't responding in a normal way to bacteria. And so that issue where the body sees the bacteria smoldering over time. Again, that's our theory, but we don't have any conclusive causation at this point. The next is called B-cell lymphoma. Now, the cases are so rare. We're in the high 30s, I think, for numbers. With ALCL, our numbers are around 1,400 worldwide, and in the US are in the 400s. With B-cell lymphoma, we're very, very low. I think where numbers are approaching maybe 38. So we don't really know very much about that. So with that in mind, the one issue that we have seen with those patients that they seem to have in common is Epstein-Barr virus. So if that's something that you've had, make sure to talk to us about that at the time of your consultation. The last is squamous cell carcinoma. This is a very interesting cancer that, again, we don't know the cause, and it seems to be involved around the implant, but also in the breast. Our numbers seem to be in the high 20s, so we still don't really have a whole lot of information regarding that as well. So these are the risks that the FDA puts in their box warnings that they want you to know about. And whenever you have your procedure, each of the implant companies have a very specific consent that will address all of these. They want to make sure that you know about these. So if you have any questions, please let us know, and I'm happy to talk to you. Thank you so much for joining us. And again, I'm Lisa Hunsicker at Ravala Plastic Surgery.